Hi everyone, thanks for coming. Good to see you.
It's been a minute.
It's been a few minutes, and it's nice to see everybody here has been here with us so long, and I can't tell you how much we appreciate your continued dedication to helping others. I mean, it's really quite remarkable. We're going through these incredible times which don't seem to ever end, and it's just so important that we're staying safe. We've been really great in this agency as far as keeping people safe and staying safe ourselves. We've had a few instances, but I want you to know our policy in general about returning to work or returning to patients. We were following the CDC guidelines, so they've just changed and they're making it like within a week you can return. We're not going to follow that, and they don't recommend it for businesses like ours. But a lot of offices and stuff, people are just returning like 3 days after symptoms. But we're still at least 14 days after symptoms and a clearance from the physician that you can return to work, and preferred a second test. In one case, we had someone get a second test 3 weeks after and they came negative, so it's probably a false positive that would come back that quickly negative. Because you see Cuomo on CNN, took 2 months or more for it to become negative. And we've had clients, and Sharon had one of them, very lovely woman who you wouldn't imagine would make it through this. Yeah. COPD, on oxygen, diabetes, overweight. And she got the virus, and she came home, so she wanted services again. So I made sure I checked with her physician, when was she discharged from the hospital, because hospitals will discharge you after 3 days that symptoms have subsided. That's what they're doing now with the new CDC guidelines. So I wanted to make sure we waited at least 2 and probably 3, and we did. We almost waited 4 till services, and she didn't care. Just so she got her services, she couldn't do anything, but her building was requiring a 2-week quarantine as well. And I gave that an additional week, and then Sharon went out there. And of course we notified her and let her know what the situation was. So we're taking really good precautions that way. And so it's that matters, because not only are we keeping our employees and ourselves safe, we're preventing the spread of the virus. So anything we can do, and that's why I would like to have a lot more people here, but I want to do distancing safely, so you know, anything we can do to prevent the spread of the virus is so important, you know. So that, just keep that in mind when we're working, is that I'm working with Bucks County and Montgomery County now, like in-services. They're not going out to cases. Protective Services hasn't been out to cases. So why do our aides need to like have these requirements that require us to do all these gatherings? So they're looking into it for me, and they're starting to see that it's safety first. Anything we can all do to stop the spread of the virus is what's most important right now. But I just want to thank you so much, because you're so dedicated, and your selflessness and you know, help for others is what this world's all about, and you do such a fantastic job, and you're special people, and we so appreciate it. About the hazard loan pay thing, there's been rumors floating around about that, so I'll give you this straight. We are reviewing the application process right now. That goes on until July 31st, and it does not take effect till August 15th or 16th, so it's only a period of time. It's like mid-August to the end of October. Yeah. So we just got it, and we're looking through that now. And of course, like anything, because we're nonprofit, me and Rich have to work on that, and then we have to take it up and get approved by the board, blah, 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 blah. But, you know, we're really pushing for it, and we have the application, so we're starting on that. It's just like some people have called and thought they want it tomorrow. I'm like, it doesn't work that way. There's a process to everything. And believe me, I found out right away, and on the weekend, last weekend, I called Rich and let him know even on the weekend that there's this, I saw this on the news, so we were right on it. And I spoke to your client today, Marilyn, who's doing fine, which is good. Are you comfortable with that? Yeah, good. And she sounds fine. Yeah, and I said I just wanted to know how you felt, because I want to speak to the person working with you. She said, already did, and I said good. So everybody just please stay safe. Claudia's got a good presentation for you. And thanks for coming from Doorstep. We appreciate that. Yeah. And any questions before I take it over to Claudia?
How about flu shot this year?
Oh, definitely.
but not in October, they recommend earlier. Is
Well,
August, September,
they've been
but they
starting-
kick in before anything.
And that depends on if they make them available that early.
Yeah, they have been though, in the past few years, they've been available like late August sometimes at Rite Aid, which was always the point, like, I don't think it's harmful, but some people say the flu's not really outbreaking then, so some people believe wait till October. It's a personal preference, but they're usually always available.
No,
by
I just heard
September.
it on the news, they recommended to
Yeah.
get it in August, September, that they hoping that this one wave goes down, and by the second wave, I don't know, we never got over the first one.
No, we haven't.
So, that it will be very complicated this year.
Yeah, so I think that, I mean, I always like to get mine in September. Sometimes we don't get ours before we get all the authorization
Yeah,
stuff. We do
usually
it
in October.
early October, but, you know, maybe we'll push that forward. But regardless, I mean, the flu season just starts in like late September generally. But, yeah, we'll check that out and see if there's a
And just
recommendation.
because of this second trouble, maybe.
Yeah, there
makes
might be.
sense.
I haven't heard yet, because there's so many different schools of thought. I don't know if they've actually established one. And other people feel differently. There's people that are very immunocompromised who may benefit from doing it earlier. And, you know, some people feel if they get it too early, it'll wear off by the thing, but technically they're supposed to last until the June, so like the flu season's over. And usually they officially, the end of June is the official end of flu season. So they try to make the vaccines for that period of time, but they mutate. Sometimes the flu vaccine they make, which they're anticipating, changes in the meantime, and it's not covering some of the stuff, so we'll follow very closely, because like I said, our health and what we do is so important, so we want to make sure we can deliver that. Anybody else? I know Claudia's got a big presentation.
If you decide to get tested for this stuff,
Mhm.
how do you go about it?
There's so many different ways. I mean, I still feel the best way is through your doctor, but if you can't get that appointment or something, because a lot of doctors aren't seeing people, because I've spoken to my doctor about if I'm getting, should I be tested, blah, 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 blah. They basically don't feel you should be tested, most physicians, unless you are exhibiting symptoms, and we know the classic symptoms are fever, are cough, and it's not a sinus drip cough that we all have because of the weather, because I get it terrible, especially with the mask on. Like people are think, you know, it's just because the sinus that.
But a lot of people don't even have symptoms.
No, it's a
That's the
dry
problem.
cough, and they're finding that 40% of the spread is in younger people who are asymptomatic.
Yeah.
So that's the problem, is the spreaders. But, you know, if you, usually though, you will get acute symptoms, and they may not last long. Other people get very, very sick, and now they're talking about the long-term effects.
Will the insurance company cover it or no?
They're
Because
supposed to
I've
cover
heard
the
that
shot, absolutely.
They said it's free for people coming out of the hospitals and it's not.
Different out of the hospitals, because most people are going to emergencies. We had someone do that, they went to the emergency room. Well, the emergency room is not, they're gonna charge, because it's not a primary physician. Primary physicians will go through your insurance. Emergency room, it's an emergency room visit.
Okay.
So the shot might be free, but you'll be charged for an emergency room visit. So I would suggest you don't go through the emergency room, because people get freaked out and they go there. It's not a physician's visit. So physicians mostly feel if you have symptoms, or you know you were exposed to somebody. And you have every right to know if you feel like it, but realize that that may give you something where you are negative, and then you could contract that a week later.
Oh, yeah.
Yes.
So, and with the lines and everything else going on right now, I think you're probably better off to, unless you've been exposed or
Stay
feel
away
you
from
have,
people, that's all.
been exposed, or you are having symptoms like shortness of breath, more than just sometimes when you're tired or out of breath because you work so hard all day, or because it's 100 degrees out. You know, and a dry cough, not usually a productive cough, it's a dry, persistent cough that, you know, hurts. Which isn't usually the time we get. The flu symptom coughs are usually bronchial. And this is more dry kind of painful cough. So, you know, but I can't answer everything definitively because it keeps changing, number one, but I try to keep on top of the information. And Claudia may know a lot more than me right now, because she's done a lot of research for this instance. I just have to stay on top of it, because the challenge for me has basically been, we've been doing so good, but you never know one day to the next what kind of call you're gonna get from anybody. We were good in the beginning, and all of a sudden we had a flurry of activity in April. We don't know what's gonna happen to May, but it's simmered, because we're doing the right thing. You know, we have responsible people that care. Clients have been pretty good too. Only one specific client did not tell us at all about a person in the home that was positive. And then after the aide leaves, the one day they called me and said, oh, he's positive. I'm like, I mean, but you can't control all that, so I just made sure I got to the aide and made sure she was safe and had the proper things, and she's fine. So, as long as we respond properly, I think that's very preventative too.
Do we have to wear the mask in the house all the time?
Yes,
It's really, and in
Yes.
public, absolutely, and in the house, you should. I mean, it's for
in the
your
client's
protection
house,
and others.
yes.
And the client should wear the mask too?
You don't have to wear a mask in your own home, but any
Not in
visitor,
my home,
right, any
I'm talking about the
visitor,
client's home.
No.
if you're in
you
a
have to
client's
be.
home, you have to wear your mask. If you're in your own home, no.
That
But if
not-
somebody comes in and visits you, they need a mask. And it's just the way it is, because I know there's a
It's the
lot of issues
protocol.
with this right now,
It's the
but you
protocol
have to wear
because
the mask in
we're
these
trying to
houses.
prevent the spread of the
No,
virus.
the client should wear the mask too.
They don't have to wear a mask
Why?
in their own home. You're in your own house. When you're in your house, are you wearing a mask? Probably not.
But you're supposed to protect them and they're supposed to protect you
Exactly.
too.
Now,
Right, but
no, I
you
mean,
can
if that client's not feeling well, they should absolutely.
Right,
do that.
if they have symptoms or something, yes, but if they're just sitting here like you and I, hanging out, they're feeling fine, they don't. And
I'm
that's in the
I'm
CDC
sure too, if
guidelines,
you're
but-
taking care of a client and you're in another room cleaning somewhere, you could probably let your
Yeah,
mask guard down,
yeah.
but have it with you, you know what I mean?
But we've been
We'll
getting a
always
lot of
walk in
calls
with it
about
on,
this.
Because
clients upset.
we could be called upon that.
Yeah.
Well, it's safety.
It's
I know,
safe,
that's
You
what I'm
exactly,
saying.
it's
The
safe.
client should-
Right, but
Keep it on.
it's, but some people are not, I went to a visit and she didn't have it on and she was within 3 feet of the client, so,
That's
that's
not
not, no, and she quickly put it on, but we
Especially
know this is
if
going on.
you're doing multiple
But
homes.
to me, I think the client should wear the mask too, because sometimes their family member or friend.
I agree,
see
I
them.
agree
You
on
don't
it, we
know.
just
Right,
can't force
but
them.
You
We
don't
can't
wanna
force
drink the
them.
I
nothing,
agree.
you don't wanna take a nothing.
I
you know?
agree, we just
But-
can't force them.
Yeah,
Yeah.
that's a slippery subject with a lot of,
Yeah, and a lot of our clients don't go anywhere, but you're right, they have family members that come in and
Yeah.
out. So I do understand that. And if you're seeing a client that's not feeling well, be sure you report it to us, we'll look into that. And, we can put services on hold if we feel that something should be done. We have done that before too. So, I mean, they said, the big thing is to respond and protect. Respond if you see something that's not right, let us know, and protect yourself always. And we just want to prevent the spread as far as, but we've been doing very well. And some people, I know what you were talking about, some people have one client that they see, so they're comfortable with them and they know they're not sick, but that's still risky. It's just the practice right now because we need to stop the spread of this virus, and that starts with what we all do.
It's kind of a mindset. I don't want to wear it, nobody can make me. It's that kind of mindset. And we know
Absolutely.
this is one way
I'm
to
American.
cut.
Yeah, who gave them the right to make
Yeah.
me sick?
It's not in the Constitution.
Nobody see it that way.
I
Everybody is
know, I
about
know.
me.
It's not a right,
We all
you
want
know,
to be
it's-
safe. We all want to be safe.
You have a right not to wear your mask where you're not putting other people
Right, in
in
a
your
private
own.
business, they can make their own rules,
Right.
Yeah, what's America's different, as you see in Europe, they've got things well under control, so we have a big country and a lot of different
But
kind of
another,
things.
a lot of,
But my
Companies.
understanding, I think, when you wear the mask, it's not for yourself. I'm
It is.
wearing the mask for you. And you
It's
should
true.
wear the mask for me
It's
too.
a two-way
It's,
street.
it's both,
It's a
on you're
two-way
right,
but
at
if people
first,
don't see it that way, a lot of people don't see it
it's
that
true,
way.
at first it was,
They're
to
like, I don't care
protect.
if I get sick, why would they
Yeah, the
bother?
first it was saying to protect other people, that was the school of thought, and you're absolutely correct. But now they're finding it does protect
It
you as
works.
well, so it is a two-way street, much like Elizabeth said, absolutely. It's just good practice, because if you start cutting corners here and there, then you leave the window of opportunities much bigger and open, Claudia,
No, they
you
just said on the news today that a lot of big companies like Lowe's and Walmart and Home Depot, I think, a lot of big companies, they said no mask, no service. They don't want their employees enforcing the law, because people been hurt
Yeah,
for it.
people have been,
Yeah, well, I haven't been to Walmart in about 8 weeks, because last time I went, there was no mandate, and had like 40% of
Yes.
people wearing masks, and
And
people were like, rah, rah. I was like, I'm not going back there until this
But
happens.
in Texas, one of, he's Well, the guard at the door, guy got shot because he told you to wear the mask, and guy came back with a gun and shoot him.
Gotta love the South.
So,
Yeah, really.
you know, people just
Fortunately, the
don't-
Northeast is a little more progressive than
Like
that.
Miss Wood.
Well, Claudia's got a whole
She-
All
presentation
right, Claudia,
full of
that's it.
information, and I wanna let her do that. Thank you,
Miss
everyone. I
Wood.
can't tell you
Thank you.
how much I
Bye.
appreciate everything you do, and
Right.
please stay safe.
But
Right.
when I come, she want me to wear the shoes cover. She want me to wear my glove, my mask, but she don't wear nothing.
No, but I think she always was like that before this even happened, from what her son told me.
She doesn't have to on her
Yeah.
own, Laminata, but you could suggest, it wouldn't be a bad idea if
Yeah.
everybody did,
So
sweetly.
So God help us. That-
Yeah, it's our business, I know.
How about the home I'm going into, they said I don't have to wear the mask.
They don't.
No, that I don't have to.
Oh,
Oh, yeah,
well, just say,
There's a lot of people
I've
like
had
that.
people say that, you don't have to wear that mask in front of me. I said, well, yes, I do, and I'm real sweet about it.
That's
It's
the
no reason
rule,
to
that's
argue.
the
Well,
company
it's-
rules.
In cases like this, I haven't heard that about the mask, but it's office policy, and then they cannot say anything.
And I could be fired, so I could be fired.
Yeah, you don't have to make
Right.
excuses,
Yeah.
just say, I feel more comfortable
Right.
doing that. Yeah.
Right.
I'm here to take care of you, protect you. But I just say, yes, I do.
That's
Period.
why I have 3 of them.
Yeah, it's good to have
One
that.
gets wet and put another one.
Yes, yes.
And how
Material
long we
ones,
should
so
wear
wash
the
'em.
mask?
Yeah.
Yeah.
The paper ones, you should
Yeah.
replace them. You shouldn't wear them if more than, you really, if they're made single use, but of course, that's not what anybody could do right now. But, use them, as you need to. I mean, you can use them that day, but if they're starting to get, you're touching them or they're contaminated anyway, and they're being contaminated from the outside, that's why you shouldn't touch them. You know what I mean? As people, we tend to do this or rearrange, but realize if you picked up a contaminant somewhere, it's on the outside of the mask.
And when you wash them, they get little fuzzies on the inside, so it's
Yeah.
tickling your
It-
nose
it
and it drives you
tickles.
nuts.
When they
It's
get wet,
crazy.
Yeah.
Claudia, thank you,
I
everybody.
made a couple myself.
Okay, I gave each of you articles. I've been saving an awful lot of articles really over a period of several months. And I tried to pick really key ones that are very scientifically based. And I did it in stages. I put them together so that the first matter of conversation is, why weren't we ready? What exactly happened? So each of you have a copy of that particular article, and the whole article is very good. It was from National Geographic, it's from July 2020. So I'm going to point out just certain things from it, and then I wanted you to have your own copy to read. In the first weeks of the coronavirus pandemic, I couldn't bear to read about our collective early missteps. Not only because the implicit rebuke felt futile, what was the point in knowing that the grim reality we were living could have been avoided? But because in my case, it also felt deeply personal. Each article I read about missing the warning signs of a devastating new virus reminded me that decades ago, scientists had been worrying about that very thing. A few science journalists were writing about their alarm, and I was one of them. Second page. If the next pandemic was going to be influenza, that didn't seem especially shattering. The flu. People get that every year. We have a vaccine for it. Then you have some pictures, and they're not colored, and I couldn't describe to you what vaccines each of them were. But if you go to the last page, on the left-hand side, down half the page, the novel coronavirus. It's transmitted through the air, replicates in the lower respiratory tract, and is thought to last for days on countertops. In addition, people can have mild or asymptomatic cases, meaning that even though they're infectious, they often feel healthy enough to walk around, go to work, cough on us. In that way, it's even worse than influenza and even harder to contain. jump down a paragraph, in countries like mine, we might have been inured to the threat of a global pandemic because we saw so many. This is the big one. Threats flaming out, confined to regions that felt comfortably remote. Except for AIDS, raging epidemics have tended not to go global. SARS in 2003 pretty much stayed in Asia. MERS in 2012 didn't really leave the Middle East. Ebola in 2014 was mostly a West African scourge. As we kept watching ourselves dodge a bullet, it was easy to attribute susceptibility in other countries to behaviors that didn't exist in ours. Most of us didn't ride camels, didn't eat monkeys, and didn't handle live bats or civet cats in the marketplace. Okay, your second article, because I'm an old, and that's true, an old alumni of Columbia University. I still get their magazine. And it had a most interesting article in the spring, summer of this year. So, there was a time from around the end of World War II through the 1960s when public health officials in the US and Europe thought that they had conquered most infectious diseases. Many of history's worst communicable illnesses, smallpox, tuberculosis, malaria, measles, syphilis, typhoid, influenza, leprosy, and the plague, were being brought to heel by vaccines, antibiotics, and antiviral drugs. And because new infections were rarely observed, mankind's triumph over the microbial world was seen as virtually complete. But, and it is a big but, in the late 20th century, something unexpected happened. Strange new infections began to emerge. First there was AIDS, caused by a virus that jumped from chimpanzees to humans. There was fatal hemorrhagic fevers like Ebola, which likely came from bats. Lassa fever from rodents, Marburg fever also from bats. There were infections that caused serious neurologic problems like Lyme's disease, which we have in Huntington Valley, which originated in mice and which is transported by ticks, and West Nile and Zika, both of which are transmitted by mosquitoes. And then, in this century, came bird flu, swine flu, and a trio of extraordinary, dangerous new respiratory ailments caused by bat viruses. As people move into previously undeveloped habitats, wild animals are being crowded into smaller areas and are mixing with more people. Simon Anthony, a Columbia epidemiologist who studies how viruses move between species, says that humans pick up these infections in a myriad of ways by eating the flesh of wild animals, also called bushmeat, by eating fruits or vegetables that have been nibbled on by infected rodents, bats, or birds, by drinking water contaminated by infected animals' urine and feces. Raising livestock close to forests is also a major risk, he says, since domesticated animals can catch infections from wild ones and later infect their owners. So, but, all the way down the bottom of the page, Buddy says that a demand for exotic animals among wealthy consumers for pets, food, or use in traditional medicine is a growing public health threat. In fact, the wild animal and seafood market in Wuhan, China, that was the center of the COVID-19 outbreak, catered to upper class clientele. I have family living in China for a period of time that were
And
teachers
there's
there.
nothing else to eat but those damn beds.
No, and I kept thinking, well, they didn't have running water. Well, you know, we have so much, we're so blessed. I mean, obviously they can't go to a sink and wash their hands. But guess what? It's sometimes people that just want rhinoceros horn because they think it will cure all their ailments. And it doesn't have to do with my kidney. It just has to do with long-held beliefs. So, number 3, inside the coronavirus. What scientists know about the interworkings of this pathogen? Thousands of different coronaviruses may inhabit the planet. 4 of them are responsible for many of our common colds. That was like red flag to me. I always thought they were rhinoviruses. But no, they're actually part of the coronavirus family. Aren't we happy? 2 others have already triggered alarming outbreaks of disease. In 2002, a coronavirus caused severe acute respiratory syndrome, SARS, which killed more than 770 people worldwide. And in 2012, a different strain called Middle East Respiratory Syndrome, MERS, taking more than 800 lives. SARS burned out within a year, but MERS still lingers. The newest one. SARS-CoV-2 has created a far deadlier panic, in part because once it infects a person, it can lie undetected for a long time. An individual who had SARS coronas did not transmit it until 24 to 36 hours after displaying symptoms, such as fever and dry cough. People feeling ill could be isolated before they made others sick. But people with COVID-19 can transmit the virus before they show clear symptoms. Not feeling ill, infected men and women work, commute, shop, eat out, and attend parties, all the while exhaling the coronavirus into the airspace of people around them. The virus can remain undetected inside the human body for so long, partly because its genome produces proteins that delay our immune system from sounding an alarm. Meanwhile, lung cells die as the virus secretly reproduces. When the immune system does hear the call, it can go into overdrive, suffocating the very cells it's trying to save. So we know we have a formidable foe. There's no question about that. You know, our head is not in sync. And the fact of the matter is that there's X amount of money. Everybody just can't have tests every single day. We have to really scientifically, very, very carefully. And the CDC doesn't need funding cut. It needs more funding. We should have been much better prepared. As such an intelligent, educated, we have some of the cream of the crop here. That's why they want to come to our colleges. And so, yeah, but what do we do with it now? Our lives have changed, just trying to go food shopping, trying to maintain the job that we've always been doing. So I fully appreciate what has been happening. We had a whole lot of trouble with masks. We were putting in orders and not getting any. So from very early on, you weren't able to get a full box of this and a full box of that. And the nurses in some of the hospitals were complaining that they were having to reuse things day after day, which is ridiculous. I mean, we already know that when a mask is wet, it's already a problem. I loved surgery, and that was one of the hallmarks of anything, that once that dressing is moist, it's transmitting bacteria. So we understand the plight that we all have been in the middle of. So some were very good with sewing, and they were able to go online, they were able to make some masks themselves, for themselves and their families. I'm a stinking lousy sewer, so I did rush up to my cousin's, the retired teacher, and she was making some, and we were doing what we could with them. But the fact of the matter is, there's a Barbara Lewis, and they made 1,000 quilts, and they gave them to the homeless, and they've been making masks. And so Barbara offered some, and Kim says they really fit well. You can each take 2 because they are washable. And so the fact is now I see them advertised in Harriet Carter, 3 for $12. Now I know that you still have shipping fee, but I mean, that's the cheapest I've seen them. I think Tristan is dealing, our nurse practitioner in the pediatric clinic. She has a friend that's making them, and I know that some of the scheduling coordinators have been ordering from her. I know that it's a problem because I have trouble breathing with them. So, you know, yeah, I'm blessed by my own office and a code to the building. I can come in on, you know, Sunday afternoon and, you know, get some work done. But I would never want to be responsible that I would know that I was the carrier, and that then what would that do to everybody vital that's working here? So we're trying to ask God for His mercy, to exhibit grace, that we can help one another. Because you each have your own concerns. You know, we're not spring chickens, so you have also medical concerns. You too may be on blood pressure medicine. And nobody is immune to this nasty virus, so we don't want it. And we can fully appreciate that. I will have to just take a day at a time, as you will. And I know that I don't want to just sit home. You know, I enjoy when I put my feet up and do some reading, but then I really want something more to feel participatory. When your children are grown, now some of you that's not true, and some of you have grandchildren that you absolutely want to see.
Yeah.
My cousin's distraught because she's not allowed to hug them. You know, they live in the city. So it's a tough time. I know how much.
They're two-sided. Oh, that's pretty cool.
Yes, and they are washable.
Yeah, I have mine. I even
Yes.
put the wire on the top.
Yes, and the wire is wonderful, and also
Yeah.
what I had asked Barbara is if she could do a couple stitches on either side. But actually, any of us, that much I could do with my needle
I
and
have
thread.
a problem to find the elastic. I went to the dollar store,
Yes.
and if you know those little things that they put in the hair with the
Yeah.
balls on it,
Yes.
I took them off
Mhm.
and I put them in.
And that's a good suggestion.
Yeah, that's my old pillowcases. I have like 10 of mine made. I made for my daughter, for my grandkids, for whoever she wanted it.
Well, it's a genuine blessing
Okay.
because the cotton ones are easier to manage.
And just to get, I made them 3 layers because they said
That's
it's better.
wonderful.
So
Yeah,
it
that's
got all
wonderful.
hot.
But
But I wash them, iron them, and keep wearing them, so they're better than
I
paper
think-
ones.
we're getting through this with a new perspective. That we're kind of understanding our time with friends, whether it's over the phone, that we really miss them, our family, that how much it really meant to us. And for Vogue magazine to have a whole darn issue and not one single photograph of any costume of any kind. And in fact, what they did was they interviewed the people that are. the head of some of the major fabric, costume brands that would normally be preparing for their fall shows. And they're really saying, you know, what is really important in life? The new dress,
Yeah.
you know, or your health. And my son with his children, they're an hour away from Rocky Mountain National Park. Our parks are healing to us. It's healing to you to be able to take a walk and to get some fresh air, to get a change of pace. And I know that some of the art museums, they've been helping because they've put on very special programs if you all do have access to a computer that you don't even have to have Wi-Fi or YouTube, like Longwood Gardens has been giving you an opportunity. You get to see more than you would if you went for the visit. They take you into some of the galleries and things in the special places. So I wanted to just end with giving you each a chance, because I don't know whether you ever heard, and I'll start with Marilyn, from your mother or your grandmother. Did they ever talk about a flu epidemic or a time?
Now she is, because it's coming back to her now. She'll be 99 in December.
Oh, wow.
She
God
knows
bless
about
her.
the Spanish flu and how many people were sick, and homemade treatments that her mother had. And they lived down south in South Carolina, so they were, it's nothing but fields and all. She said that's what kept them busy. Her mother kept them busy to keep their mind off of it. And of course they were religious, you know, they prayed a lot. But now that's coming back to her.
Glad we believe in prayer,
Yeah.
because if we don't have
Power
God's
of
mercy,
prayer.
we're really in trouble.
Yes.
But Maria, you know, you were born in a different part of the world.
Yep.
Was there anything that you heard from your relatives?
Right now, well, a friend of mine, our kids grew up together in over forever. She was in the hospital for 6 weeks back in end of November to December. And they said that she had pneumonia. They just could not clear it. Now they think that she had the virus. And they found her husband unconscious in the house. But he recovered about 3 weeks. She was 6 weeks in the hospital. And until now, they're still saying, I'm looking up on the internet, that they still saying in Ukraine there is nothing to worry about. So. But my cousin in Italy, I just talked to her today and I asked her how everything is. She's like, you know, just the way it used to be. Like, they're still cautious of everything. They don't go anywhere still, because people are afraid. So, yeah. But they have to go to work. Her husband is mechanic and she does the same thing I do, because all of our immigrants, we do what we can, because her education is nothing over there. So she does what she does, but luckily she had only one client, very rich client, so she barely missed the work, because that lady said as long as you take care of yourself, you can come every day, and that's okay, because they needed the income too.
Whoa.
So, yeah.
Well, we're glad you're with us.
Oh, thank you.
Amanado.
Yeah, when you take the test, the corona, how long is gonna take before you have your result?
It depends on where you have it done.
Yeah.
When I got admitted the morning with the heart attack, they did it very quickly and they did it accurately, because they weren't going to take me up to the cath lab unless they knew I was negative.
Yeah.
Okay, so but you see, the money, the question of the money and who was gonna pay wasn't over that, say. And the second time I went in, the same thing happened. So I think it just really depends. Now, I see the line each morning when I come to work with Abington Hospital. It is by appointment. So if your doctor feels that you do have symptoms that lead him to believe that you could definitely have it, then he can order the test and you can come and have it done. Obviously, insurances are different, because I really see that even though I'm on Medicare A and B with a supplemental, I see that they're increasing it. So, we still don't have a Medicare for all. You know, the Obamacare, we're fighting to keep so that people with pre-existing conditions can
Not
still
necessarily,
get
I
help.
need to interrupt.
Okay.
I looked into that Obamacare
Okay.
stuff. And because company where I work for offers me health insurance, and if it's under 10% of my income, I'm not eligible for Obamacare.
Okay, so it's based on income.
Absolutely.
Okay, we have an
So-
excellent social worker here in the Navigator program, that if you live in Montgomery County, she's excellent about all the insurances and will give you advice. But I think the thing is, Aminata, that we had one particular person, it wasn't an aide, that thought, you know, they really thought, but you know, history of smoking, COPD, bad allergy history. You really, your primary care physician should know you well,
Yes.
okay? And be able, because I understand your apprehension, you know. But we also need our common sense. So we are hoping, we know it's not over. We understand that.
Oh, yeah, it's not over.
Well,
I
then
mean, every
also-
time I'm going to Giant and buying the food, you
It's
know,
not over for a while.
I always did wipe, you know, and there's still things around, not the kind I used to always buy. Go to Walmart, everybody else, you know, bought those out.
Yes.
But I found that things that clean eyeglasses, they don't have alcohol in them, but they do have a cleansing agent, so that I've gotten some packages of those to use on phones, when I use patient phones, that I will wipe it after I clock out. Just to cover my bases, but I think one of our big risks is food shopping. I mean, because I'll be totally honest with you, we're tired. You know, at the end of the day, I took that orange juice out of the bag, and I took the milk out of the bag, and I just stuck it in the refrigerator. My mother cleaned the refrigerator every 2 weeks, scrubbed her floor on her hands and knees. Please, please, don't ask me.
I don't know, lately they've been saying that you're okay with the food, like if
Yeah,
you brought something
Yes.
home,
Yeah, that's
leave
not
it
good.
sit there for 24 hours, you'll be okay.
Yeah, well, who's, I'm
No.
gonna leave it sit there,
That's
I'm
actually
gonna
not
get in the
true.
No,
refrigerator.
it's not.
I
I
know
don't
they're
know. You
decreasing
shouldn't wash it.
contact.
Yeah,
I
you
know
don't
they're
have to.
decreasing
Corona, you
contact.
have to be clean.
But I worked for surgeons for 2 years, okay? You blow your nose,
That's it.
you come on, we're all human, you know? You took the mask off and then you know. So,
I like the stuff that I buy for my grandkids, books and stuff,
yeah, that's,
things like
yeah,
that.
yeah,
But when like I bought the detergent, I put it in the basement,
Yeah.
it will sit there for a week at least until I get
Well,
to it, so.
I think there's a misconception.
I'm still alive.
COVID is not living on books and
Right,
detergent
right.
bottles and all that. This is just,
I think it's
getting
more
ridiculous,
scary
but I
tactics.
think-
and also, what one of the doctors is trying to promote, especially the American diet, is atrocious.
Oh, we know
In
that.
addition to the mask, we also have to increase our intake of key vitamins and minerals and roughage. And so they did a study in different countries, and the mortality rate in certain countries is a lot lower than here in America, even though we have the best medicine practice, and it's a direct link to the diet. So we're a very unhealthy country, and I think everybody in here knows that. When you go to a restaurant, look at the portion sizes versus when you go overseas. I went overseas one time and the portion sizes were a lot smaller, more quality food, how it's prepared. So a couple of the doctors are really trying to gear towards not just the mass, but also what we're putting in our bodies will help us fight off diseases and viruses and help us improve our overall health.
A lot of
That's all I
studies,
wanted to say.
no, it's an important
the
point. 'cause they
vitamins
think
and
we need to-
supplements is
how
the
about the
biggest
clothes?
waste of money there is.
Say that again?
Vitamins and supplements. The biggest
But it's
waste of
food.
money.
Okay.
Okay, we're
Food.
talking
No,
about
no.
vitamins that you're getting from food. I'm not
Yeah.
talking
Food is
about
the
things
vegetables.
and pills.
Vegetables and fruit.
Well,
Yeah.
yeah, that's, oh, I agree with that, but, how they saying the, take increase vitamin D intake
okay.
and this and
No.
Well,
no,
you get
no.
vitamin D from the sun,
10 minutes a day and
So-
you're good.
but some people can't be out in the sun,
Right.
people that have skin cancer, so they have to take a vitamin D supplement. So some of them do work and they're very necessary for a lot of people, so.
Well, you go to your doctor because A and D are toxic if you take too much.
Okay,
So you
yeah.
don't just make your own
The virus
decision, but you can have a
stay
blood level
in
and
the
then you
closed
can
room.
do it intelligently.
But
No,
I
they're
still
saying
think-
no.
I think,
No.
what we were told at the very beginning, and what is very important to do, and what is difficult to do, stay away from your face.
Oh, yeah.
Okay.
And
Good luck with that.
is, stay away from your face.
Yeah,
But
Good
it's not
advice.
easy.
And
It's
that
not.
is
Yeah,
difficult.
but you're much more
I
aware.
we
Sometimes
totally
you
agree.
touch this one.
Yeah, I
Well,
just said it a minute
Sharon, I
ago.
never got to you. Has your mother or your grandmother
No,
talked
no, but
about?
I have Mrs. Klein, who's 105.
Oh,
Okay,
yes.
wow.
and what did she
She
say?
was 3 years old when she got this flu in 1918, and she said she remembers 3 years old, and she remembers the doctor saying to her parents, "It's out of our hands now. It's in God's hands. We've done everything we can," and she recovered. So.
And Bonnie
Whoa.
upstairs said, her
Whoa.
grandfather said they couldn't bring in the caskets fast enough
Wow.
during that time,
Right,
during the
they were
Spanish
piling up the
flu.
bodies.
They were just, and that's what's going on right now in Florida. They don't have enough morgues. And New York City didn't have enough morgues.
They bring the
Right, they were just
refrigerator.
throwing
Yeah,
bodies in
so
the-
really, really bad.
Well, we're
Brazil
down,
is bad too.
it's not last but least, because you're from Switzerland, so what has your family discussed about?
Well, it was, that Spanish flu was always mentioned, but not, we knew it happened. But probably because nobody in the family was,
Survived it.
yeah, nobody had it, I don't
okay,
know.
right.
So it was always no, we all
I
knew
never heard
that.
about the Spanish flu in Ukraine.
And we
How
all
long does
knew it,
symptoms
but
stay
there
I
is
didn't hear it.
no,
How long
I
does
learned it
symptoms
here
can
in this
stay
country,
with
and they
somebody?
said,
The
and more
virus?
now, because they said the
Some
second wave
people have had
was worse than
symptoms
the
6
first
months
one.
later.
yes, yes, yes.
So I never heard about it.
So they
Yes.
said the
But again,
first
I
case
lived
was in
in
December
Soviet
overseas.
times, it was different. You
Some
knew
still
what
have
they
symptoms.
wanted you to know.
And are still testing
It
positive.
was state
And so you didn't
regulated
hear anything about
television.
the people that died in Germany or England or any of that? They
From
didn't let
Spanish
you know?
flu?
Yeah,
No.
from Spanish flu.
I don't remember that,
Wow,
no,
that's interesting. How long have you been here?
31 years.
31 years, okay.
The last handout that I gave you on the very last page, this is from our local. It's our Abington Neurologic group. It's How Will This End? And Dr. David Weissman, they have their new building that they just completed. If you're, coming on 6/11, you will see them. He's an authority and doing a lot with Alzheimer's. And I thought this had some valuable information to share with you. But on the 4th page, he says, when the Black Death came to humans in the 1300s, our ancestors were fully in its thrall. Humans exactly like us watched as it killed between 1 and 2 people out of 3.
Okay.
Yeah.
But they did not know
Second to last
that
page.
their plague was due to a bacterium, that it was harbored by rats, that it was spread to humans by fleas, and they had no knowledge of germ theory or possible treatments. They had no methods by which to study the infectious cause, the transmission, and the development of valid treatments. So it is really in the hands of our scientists, our best pharmacies, to develop, a vaccine for this. And we need to understand that they need to be funded, the research. No, they were for you because I felt
Yeah, they're
like
all your
if you
copies.
have a chance to really read the whole thing, you might want to share it with somebody else. We have giveaways, so let's get our